1. Which teaching method best supports adult learners in herbal education by allowing practical application of knowledge? A. Lecture-based instruction. B. Experiential learning. C. Memorization drills. D. Passive observation. 2. When evaluating the effectiveness of an herbal workshop, which method provides the most actionable feedback? Anecdotal comments. B. Pre- and post-assessment surveys. C. Attendance numbers. D. Observing general enthusiasm. 3. What is the primary purpose of including mentorship in a registered herbalist training program? A. To fulfill regulatory requirements. B. To enhance skill transfer and professional development. C. To reduce instructor workload. D. To provide social networking opportunities. 4. Which communication technique is most effective when teaching complex herbal pharmacology to adult learners? Using jargon-heavy explanations. B. Simplifying concepts with analogies and visuals. C. Rapid-fire questioning. D. Reading directly from textbooks. 5. Which regulatory body is typically responsible for overseeing herbal practice standards in most countries? A. Ministry of Agriculture. B. Health Regulatory Authority. C. Local Chamber of Commerce. D. Department of Education. 6. In curriculum development for herbal studies, what is the most important first step? A. Selecting textbooks. B. Conducting a needs assessment of learners. C. Choosing assessment tools. D. Scheduling practical sessions. 7. Which evaluation method is most reliable in assessing a trainee herbalist's clinical competence? A. Written multiple choice tests. B. Peer feedback. C. Direct observation with standardized checklists. D. Self-reflection journals. 8. When mentoring a novice herbalist, which approach promotes independent critical thinking? A. Providing direct answers to all questions. B. Guiding through case studies and problem-solving exercises. C. Encouraging memorization of herb properties. D. Limiting discussions to classroom settings. 9. Which adult learning principle emphasizes the importance of learners relating new knowledge to prior experience? A. Andragogy. B. Pedagogy. C. Eutagogy. D. Didactics. 10. What is a critical component of regulatory compliance in herbal practice? A. Using traditional remedies only. Documenting client consultations and treatments. C. Offering free herbal products. D. Avoiding record keeping. 11. Which method is most effective for teaching preparation and dosage of herbal remedies safely? A. Lecture only. B. Hands-on demonstration followed by supervised practice. C. Video tutorials without practice. D. Group discussions without practical component. 12. When designing assessment tools for herbal education, what is essential to ensure validity? A. Aligning assessments with learning objectives. B. Making all questions multiple choice. C. Limiting assessment time. D. Using subjective judgment only. 13. How can a mentor best support learners in adhering to ethical herbal practice? A. Ignoring mistakes to encourage experimentation. B. Demonstrating professional standards and reviewing case scenarios. C. Giving full autonomy without guidance. D. Focusing solely on herbal identification skills. 14. Which technique is most effective in teaching adults about herb-drug interactions? Memorization of lists. B. Interactive case studies. C. Reading from a pharmacology textbook. D. Watching unmoderated online videos. 15. Which component of an herbal training program ensures continuous improvement? A. Fixed lecture schedule. B. Regular evaluation and curriculum updates based on feedback. C. Static assessment methods. D. Limiting student participation. 16. Which factor is critical when communicating herbal recommendations to clients? A. Using complex medical terminology. B. Assessing client understanding and tailoring explanations. C. Only providing written instructions. D. Avoiding client questions. 17. In mentoring, what is the main benefit of reflective practice exercises? A. Reducing mentor workload. B. Promoting critical thinking and self-assessment. C. Ensuring faster completion of curriculum. D. Improving memorization of herbal properties. 18. Which method is most appropriate for assessing the practical application of herbal safety protocols? A. Oral questioning. B. Practical simulations and checklists. C. Multiple choice exams. D. Group discussion. 19. What is a key element of effective adult learning in herbal education? A. Passive listening. B. Encouraging active participation and problem solving. C. Repetition without context. D. Limiting content to theory. 20. When developing a herbal curriculum, which step ensures alignment with professional standards? A. Selecting popular herbs only. B. Mapping content to regulatory guidelines and competencies. C. Scheduling more field trips. D. Avoiding assessments. 21. Which communication strategy helps prevent misunderstandings when discussing herbal treatment plans? A. Encouraging open-ended questions and confirming understanding. B. Giving instructions quickly. C. Avoiding client feedback. D. Using only written forms. 22. In herbal mentoring, how can mentors effectively track learner progress? A. Informal observation only. B. Structured evaluations, portfolio reviews, and reflective journals. C. Relying on peer reviews. D. Annual written exams only. 23. What principles should guide the design of adult learning assessments in herbal education? A. Focusing solely on memorization. B. Measuring applied knowledge and decision-making skills. C. Using only subjective grading. D. Limiting feedback. 24. Which approach improves learner retention of herbal safety and contraindication knowledge? A. Reading the textbook repeatedly. B. Scenario-based learning and problem-solving exercises. C. Listening to lectures without practice. D. Using unrelated examples. 25. How does mentorship enhance regulatory compliance in herbal practice? A. By showing shortcuts to reduce documentation. B. By modeling proper record-keeping and legal responsibilities. C. By allowing students to experiment without oversight. D. By focusing only on client satisfaction. 26. Which evaluation technique provides both formative and summative insights for herbal trainees? A. Practical demonstrations combined with written assessments. B. Oral questioning only. C. Attendance tracking only. D. Peer observation without rubrics. 27. What is the main goal of adult learning theories in herbalist education? A. To promote rote memorization. B. To facilitate knowledge application and lifelong learning. C. To reduce course duration. D. To eliminate assessments. 28. Which strategy best supports learners with varying levels of prior herbal knowledge? A. Teaching all content at the same pace. B. Differentiated instruction and scaffolded learning. C. Avoiding practical exercises. D. Focusing only on beginners. 29. What is the most important consideration when introducing herbal research methods to adult learners? A. Presenting only advanced statistics. B. Connecting research concepts to practical herbal applications. C. Avoiding research due to complexity. D. Focusing solely on literature review. 30. Which mentoring practice encourages learner autonomy while ensuring safety in herbal practice? A. Allowing unsupervised practice from day one. B. Gradually increasing responsibility under guidance. C. Providing step-by-step instructions without discussion. D. Limiting practice to theoretical knowledge. 31. How can a registered herbalist ensure client education is effective? A. Providing pamphlets only. B. Using verbal explanations, demonstrations, and feedback confirmation. C. Avoiding follow-up questions. D. Limiting interactions to one session. 32. When designing a curriculum, which method best integrates adult learning principles with clinical competence? A. Sequential lecture-only approach. B. Case-based learning with supervised practice and reflection. C. Memorization of herb lists. D. Written exams only. 33. What is a key benefit of combining mentoring, practical assessment, and reflective exercises in herbal education? A. Reduces course length. B. Enhances learner competence, critical thinking, and ethical practice. C. Simplifies grading. D. Focuses only on memorization. 34. When coaching a trainee herbalist on client documentation, which strategy most effectively builds long-term compliance skills? A. Giving a template without discussion. B. Modeling proper documentation and providing feedback on completed samples. C. Allowing trainees to create their own system without review. D. Reviewing documentation only at the end of training. 35. Which curriculum design method ensures that herbal learners master both theoretical and clinical competencies in a structured, measurable way? A. Spiral curriculum with progressive complexity and repeated skill reinforcement. B. Randomized topic sequencing. C. One-time lectures followed by a final exam. D. Teaching content strictly through readings. 36. A registered herbalist wants to improve the reliability of skill assessments during supervised practica. Which approach is most appropriate? A. Using a single evaluator with subjective scoring. B. Allowing trainees to self-score for reflection. C. Implementing standardized rubrics used by multiple evaluators. D. Evaluating only final client consultations.